So today in our video we are going to see about biguanides, an important class of drug under oral hypoglycemic agents. So if you see in biguanides, the only drug used nowadays is metformin. And metformin is the first line drug for type 2 diabetes mellitus. It is usually given in 500 mg twice daily and the maximum dose is 2500 mg per day. So now let's go into the mechanism of action of this drug. So when metformin is taken, it causes activation of AMP dependent protein kinase. When this AMPK protein, which is an enzyme, is usually activated, what happens is it causes various changes around the body. So in liver, it reduces the output of glucose. So this causes a reduction in the blood glucose levels. So also it acts on the intestine, and what it does in intestine is it reduces the absorption of glucose. So when the absorption of glucose is reduced, only less blood glucose is available. And also it does is it enhances the insulin mediated glucose uptake by fat and muscles. So when fat and muscle cells take more glucose from the blood, what happens? Eventually again the blood glucose level will reduce. So all these process by metformin, what it does is it all causes reduction in the blood glucose level. So now going into the adverse drug reactions. So there are a few major adverse drug reactions for these drug. So one of the common is GI effects. So such as abdominal bloating, nausea, cramping, loss of appetite, diarrhea. So all these symptoms are very common. Weight loss is also seen initially when the drug is taken. So next is one of the rare but a serious side effect from metformin is lactic acidosis. So this occurs because metformin increases the lactate level in our blood. So when the lactate level in our blood increase, it can sometimes lead to lactic acidosis. So this is said to happen because metformin alters the absorption of lactate from the liver. So also vitamin B12 deficiency also occurs. So this occurs because metformin reduces the B12 absorption from the intestine. So these are the common adverse drug reactions. So in contraindications, metformin is contraindicated in renal impaired patients. So metformin must be avoided in patients who have serum creatinine level above 1.4 mg/dl. So this is important because in these patients, if the lactate level in the blood increases, it cannot be excreted properly and can lead to lactic acidosis. So if lactic acidosis occurs, it can worsen the renal impairment in these patients. Hence, it must be avoided. And it's also contraindicated in hepatic impairment and also should not be used during acute myocardial infarction and heart failure.